Tania, thanks again for coming out. It's a kind of a nice day out there in the balmy North Ohio weather. And I have known you for a while, and you know, you were a massage therapist, and you went to, what school was it? The Ohio school?
I went to the Cleveland Institute of Medical Massage.
Cleveland Institute of Medical Massage. And you actually, you were in a commercial of theirs.
Yes, I did a commercial for the, well, they say it's the Institute of Medical Massage Schools, but I went to the Cleveland one in Middleburg Heights.
Well, you're a celebrity. Because you were in a commercial. She had her own commercial.
Yeah, all my clients see me and they say, "Oh, I see you on your commercial." And
I see you too. Like, oh, I know her. But you've been doing massage now for what? It's been 8 years?
Well, actually about 4 or 5 years now.
Okay. And you know, we want to talk and show people and talk to people about why massage is so beneficial and so helpful. And not just to help you relax, but it's also healing, and it also helps your whole body.
Yes,
so
it does.
You want to explain basically what massage, again, what it curtails, what it does, and you know, all that. You know, some people are like, I don't want to be touched, but it's a very well, it's not invasive touching, so to speak.
Right, exactly. I got into massage therapy. I'm a Marine Corps veteran. And I was in the medical field, and I really wanted to be able to help people more in depth than just do inpatient intake. Massage therapy is very beneficial, mind, body, and spirit. It does affect the muscle tissues, the lymph nodes, and it also gets toxins out that you are holding in your muscles. Massage therapy is very good for your emotional health. I have a few veteran clients with people who do not like to be touched. It's a very calming effect mentally, emotionally, and physically.
Well, I know that for me, and I haven't had a good massage in a while, and it's my fault, but my back hurts a lot. And I found that not just only does the massage seem to realign my back a little bit, but it seems like it helps, like, I don't know how, like the pinched nerves or something, but they told me, my chiropractor told me, get a massage, because the massage is going to keep those muscles from tensing back up. Is that part of the healing aspect too?
Yes, it is. A lot of people, when they have like sciatica or they have cervical outlet syndrome, where it feels like your funny bone, carpal tunnel, the numbing, the burning, the tingling. The nerve fibers get pinched, contracted within the muscles. And so what massage therapy does for that is it helps the muscles relax, so the nerve fibers are able to function like they are without having that added pain in your muscles.
Now, I've been curious. This sounds like a really strange question, but when did people decide that, you know, go from like, oh, I'm going to touch you and play with you, to massage being an actual, you know, real, like a job? You know what I mean? Like, here, I'm going to hold your leg and rub it, as compared to I'm going to work on you medically, and I'm going to work on you as a trained profession. When did massage really switch over?
Well, Kellogg, that's the Bible that I learned from, goes back to ancient times in Greek and with the Romans, and back then, and he has a book that really went in depth and with the medical perspective of it. And then the Swedish massage, which is more of a light massage, people had started realizing how medically it could go hand in hand and affect the body medically. A lot of people wanted to get away from more of the medicinal ways of healing and go into more of the natural ways of healing. And so massage therapy is more natural. You're not taking medications or supplements. It affects it in a more physical way with the muscles and the tissues.
Now, I know when somebody works on me, they always, first thing they say is, oh my God, you've got such, you know, your tendons are so stressed, and it actually, sometimes it hurts for me. And I know some people out there go, oh, you know, I had someone try to massage my neck and it really hurt. Now, that's not always the case, nor is that there's a reason for that, right?
Yes, whenever I go to do chair massages or I have somebody on the table, I definitely go in depth with, what do you do for a living? How is your water intake? Are you exercising? I go down a gamut of my checklist and what I was trained to figure out what's going on with the body. I also look at your posture. I may have you, go ahead and take a few steps away from me and then towards me, and I watch your gait. And so if somebody is lopsided, a lot of times it's because they're having issues on one side of the body, so they're leaning towards the other side. But when somebody is having a lot of shoulder issues, again, I ask what your profession is. I also start with a real light massage to warm the tissues up.
Yeah.
And then it's, I was trained that you don't do deep massage right off the back because you can hurt somebody. So you go in light and soft and you wait until the person is actually relaxed.
Oh, that's good, because the person who was doing massage on me, I don't think she had her license. She was just going straight in doing deep tissue, and I was like, ah! But we won't.
Yeah.
I won't name names, but
Yeah.
But that's because, and I know some people are concerned who have like maybe fibromyalgia.
Yes.
And they say, oh, I can't get a massage. This one lady touched me, and I was in pain for 2 weeks or something.
Yeah.
So you start out kind of like a trained professional massage therapist is not going to just jump in and start, working on you, right?
Yeah, yes, I'm licensed to the state of Ohio. So again, I go down my gamut. And with people with fibromyalgia, I actually have a patient who has that. And it's more of a very light massage where you place your hands on and you wait for the muscle fiber, the connective tissue, the fascia, to relax. And then so it's more of a light massage with people that have fibromyalgia. I was also trained, you do not go in for a deep tissue massage unless somebody has been getting that on a regular basis, because you can really hurt somebody that way and bruise them and cause more problems than they need. So it's more if I work at it to get to that deep tissue part. But a lot of people say, oh, you could do it harder. And I say, well, just, let me go ahead and do what I'm doing, and then afterwards tell me what you think. And I never get a complaint afterwards.
Well, that's good.
Yeah.
Well, I know a lot of people out there, the healthy benefits of massage. So you talked a little bit about like the lymph nodes and drainage and toxins.
Yes.
How does that work? I mean, you sit around and go, well, am I toxic? And how's that going to get out of my body when you massage me?
Right. Well, with people who have lymphatic issues, I would definitely recommend to go to a licensed massage therapist that is specifically trained in that.
Oh, okay.
Because they have more of the proper procedures to drain the lymph tissue and then give you advice on how to take care of yourself afterwards. When somebody does get a massage, the toxins that are being held in your lymph nodes and in the muscle tissue is being released. So you do need to drink water afterwards and flush your system out.
Well, I know that for me, being a cancer survivor, that's to me something really important, is trying to get lymph drainage. I kind of feel like even today I feel toxic. Past since I had surgery, I feel toxic. So I'm like, so I'd have to go. You don't specialize in that, but there are people who do.
Yes, there is.
And
yes,
so
there is.
it's a good thing you would recommend. Then it would help someone who maybe went through illness to kind of get that out of the lymph system, because again, the lymph system is what is our immune system, more or less. It helps with the white blood cells and what else? I can't remember what else it does.
Well, the white and the red blood cells, and just really when you're having swelling, it helps alleviate the swelling. Whenever I do have somebody come to me and they're having, a cancer survivor with the lymphatic issues, or somebody like a pregnancy massage, I will definitely tell them, do your homework and go to somebody who is specifically trained on that, so that you don't have somebody who doesn't know what they're doing work on you. I'm one person that I don't specialize in that. So I would recommend somebody else to go to it. And then pregnancy massage, I know somebody who specifies in that, because if you're not careful, you can actually cause somebody to go into labor.
Wow.
Yeah.
So definitely it's important to do your research with the massage therapist and ask questions before you go in then.
Yes.
So it's not just massage therapist, broad band
No.
spectrum, covers everything. So there are specific, kind of like doctors, are heart doctors and they're, you know,
Yes.
foot doctors. I guess it sounds like there are different kinds of massage therapists.
Yes, you definitely want to do your homework, and you do not, if you do not feel comfortable with a licensed massage therapist, I would definitely recommend, you know, go to somebody else, because you don't want to have a bad experience, and you are paying for your time.
Right.
And so they should respect you and what your wishes are.
Right.
I specialize more in if somebody is having muscle issues, sciatica, any kind of cervical outlet syndrome, carpal tunnel, and so forth. So that's where my
Carpal tunnel. I mean, a lot of people I know suffer from carpal tunnel. How does that work? I mean, are you like, what are you doing?
Again, well,
Like, what do you do with the carpal
yeah.
tunnel?
With the carpal tunnel, it is feeling where the attachments and the origins of the muscles, and where is it your ulnar nerve or the other nerves that are getting the median nerve or getting pinched. And so for me, I would, you know, check out the muscles, palpate, and see what issues that you're having, and then work on the muscles there to get them to relax.
Yeah.
And then recommend stretches
Okay.
and that to go along with that.
Because I know a Tai Chi teacher, say that 3 times fast. She recommended Tai Chi because it helped carpal tunnel, and she actually was able to prove in Valley City there's a factory that she went and did taught Tai Chi classes at for like 6 weeks, and everyone's carpal tunnel got better.
Yeah.
And that was stretching. But you're saying that through massage it alleviates a lot.
Yes, because
Yeah.
with massage, what I specialize in is finding out what's going on with the muscle tissues and the nerve fibers, and then going from there and working with you. Because I also like to educate my patients also on what muscles they are having issues with and how to stretch, because I do make my living, but my goal is for you to feel better, so you don't have to suffer from those issues
I see.
anymore.
Yeah.
So when I have a client, she usually has sciatica issues. I have worked on her for a period of time, and then I haven't heard from her. And then I do hear from her just for a relaxation, and she's, oh, you know, I feel bad. And I'm said, don't feel bad. My job is to make you feel better so you have a better quality of life.
Now, when somebody decides, okay, I want to get a massage, and they go to like a spa, and then they decide, okay, I want more of this. I mean, I've seen some spas that offer, you know, upper massage and lower than full body. Is that how it works? I mean, is that what's recommended? You should have a full body every time, or?
If you're a full body relaxation massage is like a treat to you. If you want to come in for a 30-minute massage, specifically working on the upper torso, neck and head, shoulder issues, then that would be great. Or say you are a runner or a cyclist, and you just want your low back and your legs and your feet done, then that would be good for 30-minute massages.
Okay.
Spas, depending on which spa you go to, is generally for relaxation.
Right.
I do know that from going to seminars, a couple of my peers will specialize in different avenues of massage that they can offer at that spa.
So maybe at a spa, it might be more relaxation and
Yes.
not I wouldn't say deep tissue, but you specialize in more the muscle. So
Yes,
I see
yes.
the difference.
Yes,
So you go
I
for
come
relaxation, you take the girls, you get your toes done, and then you kind of relax your muscles and you're done.
Yeah, a spa is like a girl's day. If
Yeah.
you come to me, I'm more like if you're having issues, then I work specifically on those issues. But I can do a good relaxation massage, and I do stone massage also.
Oh, you do stone. So that's now I've always wondered about that, because like there's this rock and it's heated up and then it's placed on you. So what does that do? A hot rock. It's like putting a hot rock on you. I could go outside today. It's so warm. You could grab a hot rock, and what would that do?
There's stones, they're balsite stones, and they are heated to a certain temperature, and they retain that heat. That is why those kind of stones are
Balsic?
Yeah.
Okay.
Well, BALSALT.
Okay.
Balsite. I'm probably saying it wrong, but yeah. And those are heated to a certain temperature, and then they are put on the certain points of the body, which would be the chakra points,
Okay.
when you are laying on your back. And then the stones are used for more of a deeper massage. It's very light, but the heat penetrates deeper.
Sounds fabulous.
It
though.
is absolutely wonderful, but I would definitely recommend use that as like a treat. I would not recommend getting a stone massage and then having a gamut of errands that you need to do later, because it is a very intense, deep relaxation because of the heat.
Okay, yeah. Now, someone was telling me that I should go to a massage therapist for, I have a lot of scar tissue, abdominal scar tissue. Is that something that would help that?
Yeah, actually massage is really great for scar tissue. The method that is used for a scar tissue actually helps break it down and smooths out the scar.
Well, that's what I was told. And I actually, why I have you on. So eventually, I'm going to get some massage done because I want it done. And I need to get rid of the scar tissue because for me, the scar tissue is all causing all kinds of extra medical issues. So, and then someone said to me, oh, you've got to get a massage. That'll help you with the scar tissue. And I was like, huh? So I have you on the spot. So it does work.
It does work. It really does. We have worked on, when I was in school, worked on scars that a different amount of us had. And it was able, after sessions, able to reduce that scar tissue and smooth it out. And when it gets reabsorbed, and then you release it.
Oh, I so need that.
Yeah, it is nice. I love massage.
I'm glad to hear that because I heard it now straight from the massage therapist, certified massage therapist. You are licensed through the state of Ohio.
Yes, I am.
Now, why don't you explain that process so people know, like, okay, instead of just like, what is it, Oriental massage spa, with a happy ending compared to a licensed massage therapist. Why don't you explain that? Well, we know the difference, but explain to the public so that the next time you look at the sports page and see Oriental Massage Studio.
Yeah, I get from my friends, my male friends, a lot of joking comments. So actually on my business cards, I do have providing quality and equity, quality and oh my goodness, providing quality and ethical massage, excuse me. So what the back alley ones, they're
not licensed.
No, they're not licensed, and they're for male
fun, fantasy, maybe some kind of weird stuff.
Yeah.
male weird stuff.
The entertainment, male entertainment, yeah. A licensed massage therapist, we have gone through school, depending on what school you go to or college, is a certain amount of hours, certain amount of book time, classroom time, and performing massages in a professional environment. And then you go to Columbus, Ohio to take the boards. When I took them, they were based off of Kellogg and the business book. Now I do know that they have switched it over to where you're more nationally licensed. So that process has actually changed since I became licensed.
Okay. But to say, though, too, how many hours of schooling did you take?
Oh, my goodness. Well, for me, being in my mid-30s, I went through 10 months. I know they did make that longer for institutional schools. Colleges, you can get a 2-year degree, a 4-year degree. But then once you become licensed through the state of Ohio, then you are licensed.
Okay. And you're licensed to touch people. Other than nurses, you're allowed, there's only 2 people that I know of, and also ordained ministers, but you don't want any ordained minister touching you, but nurses and massage therapists are licensed to touch you in Ohio.
Yes.
Like, it's okay to touch you. And so, someone, if you go and get this, you need to go to someone who's licensed and who's gone through school. 10 months is a long time. I mean, that sounds pretty thorough, and I know 2 years, that's, intense. So you can understand that these people aren't just, went to someone's basement and learned how to work on somebody and then
Right,
just
yeah.
like put a sign out in front of their house, massages, you know. So
Yeah.
you really had to learn a lot. So, and I understand there's a lot about anatomy and you know, we
Yes.
have like a thing here about all the different muscles, but you had to learn anatomy?
Oh my goodness, yeah, we learned what the doctors learn. Because I am also, well, I went to school for medical assisting and graduated with honors. And going to medical massage school, I learned all the intricate muscles that I did not learn when I went to for medical assisting. So it is, you really do need to learn your anatomy because of the muscles that you're affecting. And if somebody comes to you with any kind of like sciatica, carpal tunnel, a long list of issues, a licensed massage therapist knows what is going on with the body, how to affect the muscles in a positive way. Also, licensed massage therapists, we are not to diagnose or prescribe. You know, so if you come in to me and you say, my doctor says I have sciatica, and I'll say, okay, what issues or what are the symptoms that you're having to verify to make sure. And then because of the anatomy that I have learned, I'm able to then work on you and cause a very positive effect. So eventually you won't even need to come and see me.
Yeah, well, that's great.
Yes.
And you know, again, it's so lots of training, lots of
Yes.
studying.
Yes.
And then I understand the state boards are not easy.
No.
You know, I know some people that fail them. They
Yeah.
you know, went through school and then failed it once, twice, you know, that they had, you know, it was not that easy. It was kind of like almost like a doctor's medical kind of, yeah?
Yes, from my understanding from other now licensed massage therapists that came from other states, they had to go through Ohio schools and then get licensed in Ohio. And they had said from where they had come from, it's the hardest state to pass. So when you go see a licensed massage therapist in Ohio, you are really going to see somebody who is trained and knows how to, you know, affect and help the body in a positive way and is here to heal and not make a fast dollar.
Right. Well, that's great. Well, the kind of massage you learned, though, what is the massage that where they beat on people and stand on them and hit? I mean, you know, have you seen that on TV?
Yeah,
Is
well,
that
that is a different type of. We don't learn that in school.
what kind of massage is that? Because I mean, I've seen those like on TV shows and stuff, and you go like, oh, I don't think I want somebody like standing on me or whacking me with.
Yeah, that's Thai massage.
Thai massage, okay.
Again, when you go in to see a licensed massage therapist, you definitely should see their license displayed. Anything else that they do specialize in, they should have certificates for those. I've gone to several seminars so that I am more educated when somebody does come to me from the medical standpoint of what's going on with you medically. So if there is somebody that goes to Thai school or Thai massage for that, you definitely want to make sure that you see their license for that because you can get hurt very bad.
Well, I was at this, you know, weekend, you know, event, and it was over in Lakeland Community College, and it goes on every year. And they had this guy, this little tiny like Asian guy, and I don't want to be, you know, I don't know what he was exactly, but he was standing on the back of my one friend, Dava, and pulling on her leg and everything. And there was a crowd of people around watching this, and I was like going, oh,
yeah.
man, you know, I was just like, well, my friend Dava got up and said that was quite an experience, but she didn't, you know, she said it was good.
Yeah.
But so that's, you know, that's kind of the off the scale, it's over here kind of a thing. And,
Yes.
And most, when you see licensed massage therapists, it's going to be standard. We're gonna, you know, you know, like you said, full body, and then you say they'll say what they specialize in.
Yes.
So if you're pregnant, you want to go to someone who specializes in pregnancy massage, or you want to, so you kind of have to kind of pick.
Yes. Yes. Because in school you get like you get a touch on things, like a little demonstration. Like if a pregnant lady comes to me for a massage, I know where not to touch her.
Right.
I would definitely not work deep on her. I would definitely say, you know what, I have a friend who actually got certified in pregnancy massage. I can recommend you to her.
Okay.
Because I would rather turn away somebody and make sure they get their needs met than for me to make $1 and not affect them in a positive way. I'm just not that kind of, I'm not that kind of person.
Very ethical of you, definitely.
Yeah, thank you.
Well, so people that know you work out of your home.
Yeah.
Okay.
Yes, I do, and I mostly travel now.
And you travel in nursing homes?
Yes, I go to a couple of nursing homes a couple times a month, and that is more geriatric massage. I do have a hospice patient that I go and see to help with her quality of life. I do the chair massages for the Cleveland Marriott, and I have a point of contact that actually got me downtown to all of those.
Woo!
Yeah, did the chair massages for their
busier.
associates. I have a child with cerebral palsy. I go to their home and work on them. I do have a couple elderly clients that I go to their home. So I mostly will travel to you.
Yeah. Okay. Well, there and other massage therapists do that. So you can work. Some of them have offices, and then it's not then so unusual for somebody to have it out of their home, being their home business.
Right.
So
right.
and it doesn't mean it's any scarier or worse, but again, you should probably, if you get a massage, you know, and I know a lot of people go by word of mouth. You know, some people go by what's in the, you know, yellow pages. So again, you have to call and then ask about their credentials, ask about what they specialize in, maybe get a feel for that person. And, you know, just really quickly, you know, we talked about ethics. You know, a massage thing, you know, can be maybe scary for some women if they've had issues, a male massage therapist maybe, but what do you recommend for someone, you know, what are their rights though too? If they're feeling uncomfortable or, you know, with a massage therapist, what would you suggest someone should do?
I would say, I mean, definitely ask what their background is. Me, I'm an open book. I'll definitely answer any questions. I'll, you know, show my credentials. Make sure that, get a feel for where they're coming from and why they got into this field. And that I work on veterans, and it's very, being a Marine Corps veteran myself, you don't want anybody just touching you. You definitely want to make sure that there is a respect issue there and what their intention is. Nobody should ever expose a client while they're on the massage table.
Okay, so there's certain, like, okay, can you, now it sounds like a strange question, can you leave your bra, you have to leave your bra and underwear on, or like if it's full body, do you get naked and then get wrapped up, or I mean, what does happen? Because I'm always like, you know. Yeah,
I say, you know, whatever you're comfortable with. Generally, people will, you know, leave their underwear on. Again, you never expose anybody. As far if a lady would like to leave her bra on because she feels more comfortable, that's fine. I would just ask, you know, is it okay if I can, you know, move your strap so I can really get to the trapezius to your shoulder?
But if somebody goes, hey, take off those clothes and blah, you know, kind of run, right? Run or just like get your money back.
Yes.
So there's a boundaries. So finding something you're comfortable with is important, you know, and that. So very good. Well, what we're going to do now is we're going to go to our studio audience. We have a studio audience, and we're going to ask our studio audience to ask a couple questions. And then we're also going to show what massage looks like. And I'm going to get a massage today. Sorry, studio audience. I'm taking this one today. And we're just going to demonstrate a massage, what a massage looks like. Of course, I am not going to take off my clothes because the show has to stay on before 8 o'clock or, you know, before midnight or something. So anyway, so we'll go ahead then and let's go ahead and go to the studio audience and ask questions. All right, well, we're in the studio audience, and this is our lovely studio audience for today. And of course, now that we're taping during the day, we do need people to come down and be in the studio audience. So if you'd like to be in the studio audience and enjoy asking questions and being here, We will let you know when to come down, but generally we would like to have people, and it's during the afternoon now that we tape, so you can check the website at the end of the show, and that'll give you how to get hold of me to come down and be in the studio audience. So right now we do have some people with some questions, and you go ahead, and she has a question for Tania.
Yes, I was wondering, do you also, besides people massages, do you do any pet massages?
Actually, I do. I have 2 Rottweilers, and so I massage them. Again, it's looking at the muscle anatomy and knowing how to affect the muscles. But actually, yeah, and I have a cat too, so she gets massaged too.
Okay.
So yeah.
That's awesome. And you have a question?
Yeah. On your neck massages, how long does it take most of the time? Half an hour, 15 minutes?
You know what? It can take as little as 15 minutes. It's depending on what you would like. It does take generally a few minutes to get the muscles to relax and get the tissues to relax. So, I mean, I could do like a 15-minute shoulder massage and affect you, or a 30-minute shoulder massage, and then you're really relaxed.
Okay. So it goes from the shoulder right into the lower back, or no? That's
Yes.
different.
Well, actually, I also work on the base of the skull.
Oh, okay.
Because the muscles, they either originate or they attach from the base of the skull down into the spine, the cervical
Okay.
spine and the thoracic. So actually I would do the back of the head and also the shoulders, and I can also go into the low back.
Okay.
So the body is divided into planes. I don't want to get real medical on you, but yeah, everything is connected. So I would start with the head, down to the neck, down to the shoulders, and then I can work the upper torso,
Okay.
and then down into the lower torso if that's
And
what
you
you
do come to people's houses?
Yes, I do come to people's houses. I ended up adopting my infant nephew, so it's kind of hectic at my
Okay.
house now.
You do it
But
out of your
I'm-
house?
I'm sorry?
Do
Yes,
you-
you could also come to my house. The benefits of me coming to your house is that I can pack my stuff up and leave, and you can just relax.
Oh, okay.
Other than, I did have an office, I no longer, because of adopting my son. He's not my nephew anymore.
Cool.
But if you come to my place of business or my house, then you have to get up and leave,
Right.
and then take that drive home. But if I come to you, then you can just, sit
Chill
back
out.
and relax and not worry about a
Sounds
drive.
good. Sounds very good.
Well, you were saying that you had going to a chiropractic because you were having issues.
Right.
So basically doing this hand in hand, going to a chiropractor and then going to a massage therapist, you're going to get a lot more benefits out of both of them than I would say per se just going to one person.
I go chiropractor once a month.
Yeah.
You go to, yeah.
So, I
Yeah.
haven't done the massages yet,
Oh,
but
no.
I'm thinking about it.
Massage
See,
is
we
great.
have, by having a massage therapist on today, we have now someone who goes, hey, I think maybe it's okay. I'm not afraid to have someone touch me, and it's not gonna hurt.
Right.
It's gonna feel good.
Right.
So awesome.
Yeah.
All right, well, that ends our question and answer segment. And again, if you'd like to be in the studio audience, you'll have to go to elizabethhowell.com and definitely check out and sign up to be in the studio audience, and we'll let you know the next time we're taping. So thank you, girls, and thank you, Tania, and we'll go ahead and get back to getting a demonstration then of what a massage looks like, or how it feels, or how it looks and feels. Okay, well, here I am on the table, and we're going to do a massage demonstration, and I can't wait because my neck is so tense. But so Tania's going to show us what a massage is like, and so you all will have to go with us here on this. I am laying on the table, and she's going to show you on hands-on what's going to happen, and I can also let you know how it's feeling. So why don't you go ahead, Tania, and describe to us what you're going to do, and start showing us for the camera.
Okay.
And you want my head like down, right? So I'm gonna put my head down.
Yeah, so generally when I have somebody on the table and they are on their stomach, I will ask them what is comfortable for them as far as their arms. Usually I have their arms down like that, so then you're in a more relaxed state. Again, I only uncover the area that I'm working on. I'm going to use a little bit of massage cream that will And it's lavender. Yeah, but I always also ask too if anybody is allergic to any kind of scent or oil or cream, what they prefer. Okay, and then I always ask permission before I touch, so I make sure. May I touch?
Yes.
Okay. So then here, generally, in the beginning of the massage, she would be on her back, so I would work on the muscles on the shoulders here, and all I'm doing is just taking the muscles, I know the way the muscles are running, and then just gently going that way. How does that feel, Elizabeth?
Good.
And how is my pressure?
Oh, soft and gentle.
Okay, good. Every licensed massage therapist should ask what kind of pressure the client likes. If at all time a client does not feel good, you do not feel like the pressure is enough or too much, then please, say so.
So if I scream, that's a good indicator that it's not a good thing, right?
Yeah.
Okay.
You should always feel comfortable. Don't ever feel like obligated to your massage therapist that you don't want to hurt their feelings. You are the one that is paying for the session, so you definitely want to make sure that you are getting what you are paying for. And now what I'm going to do is just go down the side of her spine and loosen up the muscles from the vertebrae.
And if you were doing a full body, then you would go, oh, up and down.
Yeah, I would go all the way down.
Yeah.
And
That's why
what-
you would probably have to have your shirt off.
Yeah, and
Yeah.
what this is doing is it's getting the muscles to relax from the spine. A lot of people have a tight spine, whether it is the upper thoracic or the cervical. Going along the spine and just loosening up those muscles is very relaxing. Come this way so I can really. And also too, if you go to a chiropractor and there is a licensed massage therapist in there, you will feel where the client is out of alignment. You can actually feel where the vertebrae is out. As licensed massage therapists, we do not manipulate. We do not put the vertebrae back in alignment. That is not in our scope. But by loosening up the muscles along the spine, it really helps out if you are out of alignment.
I can tell you that feels good.
Good.
Am I out of alignment? Probably.
Actually, thoracic, where I can feel up here. No. What? Yes, you are, right here. Actually. And if you are out of alignment and the massage therapist feels that and tells you what it feels, does this feel a little sore?
Yep. Yes, it does.
Okay. So when you are out of alignment and the massage therapist goes along and feels that, and if it feels a little sore, that's because you are out of alignment there.
Yep. She hit the right spot too. I want to tell you, she knew right away, and I had a car accident.
Yeah. How's that feeling?
I'm very ticklish too, and I'm not giggling and rolling off at the table, so you're lucky.
Good. Yeah, what my pressure is, it's almost like kneading dough, bread dough. And that's why a lot of people say, oh, I want you to work deep. Just doing this it's getting the tissues to loosen up, it's getting the muscles to relax. This type of massage is going to be more beneficial because I'm not traumatizing the muscle or the muscle fibers.
Yeah.
I'm just taking them and kneading them and going into the angle of where the muscle fibers run. So I'm working on her trapezius. How does that feel?
Very good.
Good. And this is just real slow. And you always want to do both sides. The body is connected. Everything, all the muscles, the connective tissues, the sheath, are all connected. So you don't, even if you're having, say, a sore shoulder, if Elizabeth said, can you work on my shoulder a little bit more? I would work on your shoulder, but I would also go to this one because the body is married. And if she's having soreness here, then that usually means that she's compensating by using this side. So this side will tire out and eventually become sore also, so then she'll have two sore sides.
And that makes sense to me because I do have as soon as I can compensate that limit. My neck has always got a problem.
Yeah. And then again, I will also work on the occipital bone, which is the base of the skull. How does that feel?
Feels good.
And what this does is it starts to relax all the muscles in the skull and then going down into the neck. So everything is married. So with somebody who has shoulder issues, I would start at the base. I would also actually massage a little bit more, but I'm not touching her hair. And then I would work on down. Yeah.
Okay. Well, then if you do the full body, it would be, all the way down, so for this demonstration, you're just working on my upper body. Takes, 5-10 minutes you're showing. But for a full body, an estimate, front and back, would be about an hour, yeah?
Yes.
Okay.
Yeah. And for people that actually they have ticklish feet, and if somebody doesn't want their feet touched, then the massage therapist could actually spend a little bit more time on the problem areas that you are having.
Yeah, so that really felt great. I can feel the warmth, in my skin. It didn't hurt. And trust me, I've had some people that like touch me and they put these pressure and they make me scream. I'm like, it hurts. Oh my God, stop. But she didn't do that. That felt really good. My skin feels good. And I feel warm. Like I feel the warmth and my muscles are warmed up. I can feel my muscles warmed up, which is really nice. Like without, instead of having a heating pad or whatever. So that, I feel really loose now. Thank you. So that's really cool. And, being with someone who's licensed it's really nice because I can tell you know what you're doing. Like you're not hitting any place where I'm hurting. You're avoiding where I said, yeah, that hurts a little bit. And I really appreciate that because there's no sense in getting a massage if you're going to be hurting.
Yeah, that's true.
So you want to walk away feeling good. So thank you.
Oh, you're welcome.
And hopefully, that'll show people, not to be afraid, have a massage. It's not going to hurt. It's going to be fun. And it's lots and lots of benefits. So again, well, thank you, Tania. And, I really enjoyed it, and I would love to have a full hour. I think I will. So this has been great. I'm going to be able to walk away from the studio today feeling really good. So, well, thanks again, Tania. That was a great demonstration. So
you're welcome. I'm glad I can come in and do this.
All right, great. Well, that is our demonstration for a massage, and I'm really going to probably just stay on the table. I don't know. I may not get off. So anyway. So we'll go ahead and go back and wind up the show.
Well, we had a great demonstration with the massage, and I want to thank you again for coming down and showing everybody about massaging. We want to thank the studio audience for their questions that they asked. But to wind up tonight, though, there's something else that you have been doing. You said, you're a vet.
Yeah.
And you have been working, explain what you've been doing, with helping vets.
Okay. I'm a Marine Corps veteran. I went through training as a peer veteran, and out of Brecksville, before Brecksville closed, I had my own women's group. I was also being a peer veteran in a women's group that have suffered trauma while being in the military. I also work with veterans that have post-traumatic stress disorder. I would definitely say, as a veteran and being in the VA system for the last 15 years, they really put veterans first, and their emotional and mental well-being, their physical well-being. They are very respectful on the point of if you want to go holistically and not be medicated, or if medications are needed, that you can maintain a low dose and work with your doctor and your therapist about getting off of medication. It's
Wow.
not something that you have to be on your entire life.
Well, that's terrific, Tanya, because I think our vets out there deserve to have an alternative way to deal with some of the trauma that they've been through. So a suggestion is, maybe massage therapist, Reiki healing, talk therapy.
Yes.
And you've been working with women, but you work with men. So
Yeah, I
I
do.
think that's fantastic work out there. We want to really congratulate you on that. And I
Thank
remember
you.
seeing your article about you in the newspaper, Plain Dealer, about what you were doing. So it's like, yay, doing a great
Yeah,
job. So thank
yeah.
you so much for the vets. And if you people want to get hold of you, we're going to have you posted on my website, but you can give out your email or your website address. So what is that?
Healing Gemstones at Yahoo.
Okay.
You can definitely email me there if you want to get in contact with me for a massage, or if you know a veteran or you are a veteran that is having some emotional and mental health issues. I'm a great point of contact. I can get that veteran the help that veteran needs.
So we'll put that up at the end of the show for you. So if you want to catch her website and her email address, we'll do that. So again, I want to thank everyone for tuning in to Psychic Sushi. And again, this is Reverend Elizabeth Howell, and we want to thank again Tania Oliveros.
Yeah.
And this is Psychic Sushi.